Ochsner is the first healthcare system in the state of Louisiana to establish an Office of Professional Well-Being.
The Office of Professional Well-Being was created first in 2018. When we first measured burnout, about 51% of our employed physicians and APPs had some element of burnout. Burnout impacts quality and safety. It impacts a number of leading indicators that indicate the overall health of the organization, and thus the quality of care that we provide. So we knew that we had to address it.
The organization supported providing us resources to establish an actual office that would be dedicated to that work.
We had a number of initiatives that were underway, and then in early 2020, we all know what happened.
The pandemic changed everything. It became evident that you can't just look at one or two elements of the healthcare delivery ecosystem in isolation. The workforce well-being of our nurses, of our medical assistants, of our PharmDs drive the workforce well-being of our whole care delivery team. So we had to broaden scope to all 37,000 employees.
In 2022, Ochsner Health received a grant from the Health Resources and Services Administration, HRSA, to establish programs and increase their work to improve mental health and reduce burnout among their workforce.
The HRSA grant has been incredibly helpful in allowing us to scale. Our initiatives currently are aggregated around 5 strategic areas of focus. Those are practice efficiency, leadership development, promoting an organizational culture of well-being, and resilience, and then mental health. And the reason I say that is it's not just resilience and mental health, building stronger canaries. You have to redesign the coal mine. So we're intentional about a multifaceted approach to workforce well-being.
So the Personal Leadership Program is a 3-day intensive retreat program for our physicians, our advanced practice providers, and our senior leaders. For many of our folks, this is the first time that they've had dedicated, protected time to take a deep look at themselves. We saw reductions in burnout. We saw significant improvements in value alignment with leaders and reduced intention to leave the organization. And we know that the results of the retreat actually stick for years.
In the first year, we implemented EHR Tap and Go for physicians who are at a workstation. They're constantly having to log into their computer. I think that sent a message that we were intent on investing in initiatives that would reduce time.
Cabana is a virtual platform. You can log on at any time. You can change your voice, you can change your name, you can use it on your mobile device. We recently installed Cabana Pods, a place for people who don't normally have private space. Cabana is easy to use and it can be tailored to you. The things that my colleagues enjoy doing may not be the things that I feel like I need for my mental health and well-being. Maybe you have 5 minutes, maybe you have 15 minutes. It might be specific mental health, but it can be a whole host of other things, like virtual sessions facilitated by licensed clinical experts. You are interacting, collaborating, and sharing your experiences with other caregivers outside of just the greater New Orleans region. And that's been a significant positive impact for those leaders and employees in those regions.
Every single one of the facilities that the HRSA grant has supported is in a medically underserved area. We also have a number of facilities that are covered by the grant that are in rural areas. It allowed us to actually bring these services to our employees working in rural settings in ways that we hadn't ever really been able to do before. I see the work that the Office of Professional Well-Being is doing is really around culture change.
Whatever the size of your team is, to think that you as a team can be responsible for the workforce well-being of 37,000 employees is fantastical. It has to be an office that can partner with other business units.
I think that we made the unintentional great decision to have the Office of Professional Well-Being is a part of the HR team, because working in HR, you have the 30,000-foot view.
I've been able to watch over the last 5 years the culture shift from one of cynicism towards well-being towards fully embracing it.
Our employees have really appreciated that the focus is on them, and I think we've seen that in the response that we get to our programs. I do think having Dr. Girgra as our Chief Wellness Officer also helps with that.
Honestly, I thought when you become the Chief Wellness Officer, great, everybody's going to think you're their best friend. Trust has to be earned, but it also has to be extended. When you see the government, the federal government, prioritizing workforce well-being, it sends a strong message.
The grant through HRSA allowed us to fund a number of programs that we would have otherwise not been able to fund. But we're not done. This is by no means mission accomplished. It's been a really special thing to be a part of this team.
I'm very proud to be a part of an organization focused on well-being and establishing an office, investing their resources specifically dedicated to that.